Welcome to week 4, chapters 10, 15, and 18. Chapter 10, Workers' Compensation Case Management Overview. Workers' compensation pays 100% of medical costs for injured workers, and it pays cash benefits for time lost after a waiting period of generally 3 to 7 days. Death and funeral benefits are also paid to worker survivors. Workers' compensation programs are financed almost exclusively by employees and are based on the principle that the cost of work-related accident is a business expense. Employers can purchase insurance from state fund or private insurance carriers, or they can self-insure. Workers' compensation was one of case management's earliest practice settings. In fact, professionals involved in assisting individuals recovering from injuries or those with mental or physical developmental disabilities were called medical rehabilitation or vocational rehabilitation specialists. The birth of modern-day case management can be traced to the workers' compensation market in the early 1970s. A true pioneer in the field, George Welch, was the driving force behind an in-house rehabilitation nurse program within the Insurance Company of North America, known initially as the MEND program. Case management started in the workers' compensation field with major insurance carriers such as Liberty Mutual, who hired rehabilitation nurses to help handle those medical aspects of work-related injury claims for the employees of its policy holders. In the early days, the case managers were all RNs who worked in the field. The field grew tremendously during the 1980s when carriers and employers realized they could save dollars and get their employees back to work sooner while reducing their cost. The difference between the decades in that today, there are many more carriers that have their own established programs with internal staff or who use the services of a regional national company, offering a full menu of case management and managed care products. As the cost of medical care continues to escalate, increasing the cost of workers' compensation premiums, many states stepped in with their methods to control or at least try to manage the medical costs associated with work injury care. The medical case manager and/or vocational rehabilitation specialist is uniquely positioned to evaluate, coordinate, and facilitate the injured worker's progress, not just in healing and recovery, but from injury, and also throughout the process that will result in timely return to work. The Affordable Care Act, also known as the ACA, was enacted into law in 2010 with the aim of making health care accessible to all Americans while simultaneously containing costs. The elimination of lifetime caps on medical insurance coverage has already made some difference in cost shifting from medical plan to workers' compensation. Under the ACA, a health insurer can no longer refuse to insure anyone with a pre-existing condition, and in workers' compensation cases, there are often a number of comorbidity factors, disease or conditions that often complicate the healing of a work-related injury. Employers who hire veterans will likely have to accommodate their physical and mental injuries because of their service, and the overall impact has yet to be determined. The issue will arise when a veteran with a service-related injury then sustains a work-related injury. The waters may become murky when a veteran might choose to obtain treatment at a Veteran Administration facility, and the federal government might seek reimbursement for the care that is not deemed work-related. In the past 10 to 15 years, there has been a shift from litigation claims to mediating them. Proponents of mediation emphasizes its societal benefit as a peaceful way of resolving disputes and eliminating conflict. Although it is more commonly used as a settlement tool in civil arena, mediation has been gaining greater acceptance in workers' compensation cases. The mediation of some cases will be welcome news for case managers who are often caught in the midst of the often lengthy litigation process. Unlike group medical, long-term disability, and short-term disability insurance, where a master plan is written for national company and health benefits will be the same whether the employee of a California company lives in California, Minnesota, New Jersey, workers' compensation falls under the guidelines of the state in which the policy is written. Workers' compensation regulations therefore vary from state to state for companies with coast-to-coast operations. Similarly, a case manager's activities will also be dictated by each state workers' compensation process. State workers' compensation guidelines take precedence over the funding source. Employers who provide employees with the level of benefit the state mandates, not the level of benefit they can afford. Regardless of whether a company is self-funded, self-administered, or utilizing a traditional plan, workers' compensation cases fall under the jurisdiction of the State Workers' Compensation Commission, whose law and regulations set the limit of and extent of coverage. Chapter 15, Reimbursement, Resources, and Challenges. Because the activities of case managers are largely mandated by both federal and state regulations, it is the case manager's responsibility to know the effect of state regulations on different health insurance benefits. In the majority of cases, case managers will be employed by the payers, which is the insurers, and their work will be governed by the group, department, or agency carrying the fiduciary responsibility for the benefit plan. This entity defines what will be covered and what coverage will be cut or phased out so as to ensure that not one person or group or persons makes excessive claims that consume all the benefit dollars in the plan. In traditional insurer-client relationships, a company and individual pair an annual premium to an insurance firm. The cost of any particular benefit plan is determined by the breadth and length of coverage that will be provided, the age, sex, and health of the individual at the time of the plan is drawn up, and the statistical likelihood that the individual will suffer from a disease or disability. Generally, group plans in which insurers cover a body of employees or associates in the same industry along with their dependents are available at a lower premium than those plans for individuals. It is the insurance firm's responsibility to invest and manage the premium dollars it receives to ensure its ability to pay claims. In response to rising insurance costs, many businesses have pursued alternative financing methods such as self-insurance. The switch to self-funding results in a significant initial reduction in healthcare benefits costs for individual companies. In self-funding, companies assume dollar-for-dollar responsibility for employee health care and avoid the spillover of financial responsibility previously included in their premiums to cover other clients an insurer company might be carrying. However, self-insured firms run a risk. By narrowing the universe of contributors to their health benefit fund, companies also limit their payout capabilities. Financial liability is spread among a smaller group, often without the application of support systems such as pre-admission authorization, utilization review, claims review, or case management to help manage the benefit program. A few catastrophic claims, such as a premature infant or organ transplant, leukemia, or head trauma, can eliminate any bottom line savings. With the appearance of self-funded plans, two other types of service companies became prominent: third-party administrators, TPAs, and firms offering administrative services only, ASO contracts. TPAs are those insurers or companies providing ASO contracts to take on the administrative responsibility of handling claims for self-funding groups. To handle an unexpected rise in healthcare costs or a number of catastrophic or chronic claims, self-insured employees often invest and access a surplus lines of insurance such as reinsurance or stop-loss coverage. It is often purchased in combination with capitated payment arrangements to help protect employers against a fluctuating utilization within their employee groups, as well as those unforeseen very costly cases. Premiums are paid to a reinsurance firm. Establish a plan that commits the reinsurance firm to step in and cover health benefit payouts in the event the claim should surpass a set dollar limit. Minimum premium is another means of financing medical benefits. In this method, an employer pays a segment of the regular premium to insurer to administer the benefits program and provide specific and aggregated stop-loss insurance. The employer maintains a bank account that the insurance company taps for payments of claims. Minimum premium differs from straightforward stop loss in that the employer maintains the funding source rather than purchasing stop loss or reinsurance coverage from an insurer. It provides some of the economic benefits and tax advantages of self-funded plans without the deep restrictions that can be associated with fully insured plans. Regardless of the size of the company, its method of insuring and administering health benefits, it is the case manager's responsibility to know the allowance and restrictions of the benefit plan. In addition to the setup of the plan, the case manager needs to know the relationship, the referring party of the claimant. The referral source will also affect how the case management can be managed and the amount of autonomy that the case manager will have. Along with claims payout, many insurers, TPAs, and ASOs serve as broker administrators and provide a broad range of specialty ancillary administrative services. Employers have to manage employees' growing sense of entitlement in conjunction with their disconnect regarding risk factors and the true cost of health care. To bring employer-sponsored healthcare coverage more in line with reality, companies are beginning to share health risks and costs with employees in the form of consumer-driven health plans and are educating their covered population on the importance of wellness. A coalition of more than 135 public and private organizations providing healthcare benefits, the Leapfrog Group representing approximately 37 million healthcare consumers in all 50 states. It works with medical experts around the country to identify problems and suggest solutions in hospital systems to avoid preventable error in patient care. Payers who want to know how successfully a case might be handled through a case manager prior to giving the go-ahead for its application, so current standards lump all cases together. Case managers have created a win-win scenario and both parties and payers are well-deserved. Case managers are providing services and working cases in many practice settings. But when they are employed directly by the employer group, hospitals, or insurance company, case managers have a greater opportunity to review medical care and benefit dollar protection issues thoroughly and to position case management within that organization and to its client groups as a solution to escalating healthcare costs. The next step in educating insurance providers and administrators is to convince them to put case managers in more pivotal positions and make them an integral part of high-level management where they can report the true benefit of case management, expand case management services to multiple lines of insurance, and increase the value, marketability, and awareness of case management. Chapter 18. Working effectively with claims departments, case management, and consulting roles. The amount of interaction with the claims department will depend on the structure of the case management department or company. The individual case manager may have more or less freedom to communicate directly with the claims department, benefit examiner, or a claims adjuster. Case management and claims services are rarely integrated, and both the patient and the program suffer. The ideal case manager-claims relationship does not exist. However, this does not mean the case manager should ignore the benefits of the liaison or hesitate to establish it. The lack of a communication protocol does not free a case manager from the responsibility of knowing claims issues and claims personnel, because whatever work a case manager does is eventually forwarded to a claims department. Job functions vary from claims office to claims office. Titles such as processor, examiner, and adjuster may be interchangeable, and each may denote different jobs with different responsibilities. There are people charged with making claims payments and enforcing whatever insurance benefit contract might be in effect. Their responsibilities include the accurate and timely payment of claim in a manner that follows contract language and document their activities. In general, the following titles and activities are fairly consistent across organizations. A consumer service representative is the first person an insured person speaks to regarding eligibility, coverage issue, and pain allowance. A claims process may not be the decision maker, but does put claims into the system. A claims examiner is a claims processor who has the necessary skills to examine claims and make decisions as to whether to approve, investigate, or deny. A plan administrator has responsibility for overall administration of the plan and handling appeals, plan design, and changes. Broadly speaking, claims examiners have no background in medical terminology, and an experience they do get will come from day-to-day job site training or from courses they attend in medical benefits administration. Case managers and examiners view each case from totally different perspective. Whereas case managers view a case globally and consider the patient's entire medical history and experience, claim examiners are presented with case on an item-by-case basis, checking on ICD-10 or IPD codes. Further, examiners are productivity-driven. The money that is going to be made by their employee will be made by getting the claims in, getting them quickly and fairly administered, and getting them out. There is no staffing pattern common to all claims departments, and there may be little true account detection. A claim comes in, and anyone in a room or of examiners may process it. Some companies do set up account-specific groups. Another department may section its staff by procedure, surgical claims staff, dental claims, anesthesia, administration, surgical, dental, and anesthesia claims for the entire covered population. Claims personnel have their own set of criteria that they must meet on the job, and case managers can create much better relationships by taking the time to understand claim issues. Some of the issues are pre-existing conditions, the funding vehicle, insurance contract language, COBRA coverage, eligibility, and coordinating of benefits. Cases that benefit most from case management commonly involve the most expensive services. This is where a case manager's clinical knowledge comes into play. His or her feel what constitutes a big case. Having developed a set of indicators, the case manager then needs to communicate them to claims personnel. The real key to consulting in case management is demonstrating to a client that only a small percentage of an employee group is responsible for generating the majority of claims and the bulk of benefit payouts. Nothing speaks louder to a client than a report taken from its own group experience. A case manager can also track individual claim histories. In particular, he or she may want to look at the claim histories of a few individuals responsible for the bulk of the claims for a given period to see if there is a case where a case management could have made a difference. Do these claims indicate a healthcare time bomb? Was there a real problem? Why isn't the ulcer resolving? Case managers working with the claims department use their curiosity, instinct, and a paper trail to look for items to uncover potentially serious cases. Obviously, the more experienced the entire team, the better they will be at following the paper trail. But any case manager and any group of claims personnel can make a major difference for their clients and the covered patients.